Thank you for joining us for another Prep Advocates Unleash, a new series from Prep for All, where we talk to prep users and advocates, talk about the benefits and challenges for accessing prep, to continue to mobilize our community to advocate for policies that will increase prep access and push back on current and emerging threats, such as threats to funding and HIV infrastructure. Cristhofer is a public health student at Emory University and is also a PrEP user himself. Cristhofer, mind telling us a little bit about what you do at Emory?
Sure. So, hello everyone. I'm Christopher Moreira, and currently I'm in my second year at Emory University, studying a master's in public health with a focus on health policy and management and a certificate in infectious disease epidemiology. And some of my involvement at Rollins School of Public Health, I am a research assistant for a lab that focuses on expanding PrEP access to pharmacies in the Southeast. So that's including states in the Southeast like Kentucky, Alabama, Georgia, North and South Carolina. And with that, we contact pharmacies to get a better idea of their practices, but also their barriers and their facilitators to being able to provide this type of access, these types of services to their extended community, whether it be rural or urban. And then also, I work on a separate lab that works on updating the injectable PrEP locator. So, similarly to how the CDC has a PrEP locator, we're doing our own version of it. And we're trying to find where patients can get access to injectable PrEP now that it's something that has been more discussed recently. Now that there's the twice a year injectable PrEP, so that has been in conversation. And really, just devote most of my time to being a student, being an advocate, helping my new students with their onboarding that are coming in for the school year. And yeah, that's some of my involvement.
Thank you. So, and you're also a PrEP user yourself. Did you start taking PrEP before you started doing this work? Like, how'd you find out about PrEP and what made you decide to get on it?
Yeah, so initially back in 2022, I had just graduated out of my undergrad and I decided to do a program in Atlanta, Georgia through Morehouse College. And Morehouse had a program where we did a mini public health research program for the summer. So I was there for about 8 to 10 weeks. And with that, I had a mentor that was a professor himself at the School of Medicine, the Morehouse School of Medicine. So a lot of his initiatives were doing outreach for prevention services, educating his community on HIV treatment. And he had a couple of different groups where he did outreach and would go into bars and host bingo nights, karaoke nights, but then also provide condoms, provide education about PrEP. And I thought that was that's something that really started sparking my um, like knowing more about what is out there, knowing more about what is there for prevention. But it wasn't until I went back to New Jersey, which is where I grew up in Newark, New Jersey, where I decided to dedicate the same stuff that he was doing back in Atlanta, but doing it for my community in Patterson, New Jersey. And while I was there, I became a community health worker for those that were recently diagnosed with HIV to then help them navigate linkage to care. And I had a mentor again there that told me, well, it's like you take it as a way and you realize that it's now that you have this education and now that you're setting an example for patients, and it's something that you can potentially also consider, and also is something that you can find access to. So I went through that journey. It wasn't easy initially, but we'll get more into that as we go along.
Right. So has it been a positive experience? I know there's challenges with accessing PrEP, but what are some of the positive experiences you have had? Has it had a positive experience on your love life, your sex life, your personal life, mental health?
Yeah, I would say definitely has been positive on my mental health because it reassures me that I'm making sure that I'm keeping myself and my sexual partner safe. Also, I it just takes it makes me think a little bit more differently about how prevention can happen. And even when I was doing the training as a community health worker, I was looking also at the science because I wanted to understand it a little bit more and how one pill can potentially help secure or safeguard those white blood cells that are in our bodies and they help with the immune system. So, thinking about it from a scientific lens and thinking about how it would look like inside my body, I thought about it and it made sense to, be a part of, be an advocate for PrEP because it's something that it's been um, you know more about it through the science. You know what it can do for people, and then you know that it is a part of making sure that you and your community are safe. Um, so that's on the mental side. And it also has helped me be a educator too for patients when I was working in those um, when I was working as a community health worker. So when I was working in the field as from a community lens, it made me realize that's something that I should also let other patients know about.
Right. So, what are some of the challenges that you have experienced yourself and seen, like just doing the work that you do? What have you seen, challenges you've seen for people trying to access PrEP in your community, and just personal challenges you may have encountered with trying to access PrEP?
Yeah, I will say with my community, let's say that there is a patient that is uninsured and they have limited access to providers, or maybe they think that because they are uninsured or they don't have the best insurance from what they've done their research for that they feel like they can't get it or they've found ways to find like virtual care but let's say like it's not available in their state. I remember initially when I was looking for my prep options, someone had recommended the telehealth option, and it was through an organization that was doing prep access but in the south. And because of that my insurance wouldn't have covered it, so I wasn't able to get it mailed to my house. But then I was doing my own research and looking at like, okay, what is available in my clinics, what is available, where can I find an infectious disease specialist or a clinic that has a prep navigator. But unless you know about those things, it's kind of like you're not entirely sure what is out there. So I was able to find a prep navigator that then connected me with a primary care doctor. And then from there, they had a similar program where they didn't have the prep available at the pharmacies, but they would be able to mail it to me. Then came a separate challenge, which was because I was living with my parents at the time. My mom found this information. She couldn't couldn't wait for me to get home, and she opened up what was the medication, and she didn't know, and she was like, "Are you?" She thought her first instinct was thinking that I was on treatment instead of on prevention. So I had a conversation with her about what I had been educated on to educate her because she was someone that wanted to be a doctor in the past, but she couldn't. Um, it was almost as though like if when I broke down the scientific aspect, then she understood that this was something that is meant to do no harm and is not based off of treatment, but based off of prevention. So a little bit of the stigma also happened
Right.
in my household, but I had to really sit down with my mother in order for her to understand what it can do for me.
Right. And something you talked about, just reaching out to rural communities and telehealth. A big part of what PrEP for All has been doing is advocating for a federally funded national PrEP program, which would address coverage barriers for uninsured and underinsured individuals, as well as expanding provider access through educating providers and providing telehealth to communities that don't have PrEP clinics, easily accessible, and also just community-led campaigns to educate. So you kind of already talked on some of those things like the coverage barriers and also just reaching like people in rural communities and also just educating people, changing the stigma around that. So, what are the challenges that you would see for your community if suddenly insurers stop covering the full cost of PrEP, or if community-based organizations and clinics and health departments lost funding to be able to provide PrEP access? What would that look like for you and your community?
So right now because I am in Atlanta and going from living all my life in like northeastern cities to now being in a southern city where everything is a little bit farther away and the transportation system is heavily reliant on having your own car. I think about the people that don't have access to transportation. I think about the people that what would have been a 15-minute ride to their provider now has become complicated because they don't have that as an option. And now they're thinking, oh, like, would there be telehealth? Like, no, if funding gets cut, then that's also something that could potentially be affected.
Right.
So I think about how there would be less access in a space where there is already less education that is happening due to systemic barriers with the way that we talk about sexual health in some states. And that just ends up increasing the likelihood of someone uh, who could potentially contract HIV because we're getting rid of the resources that would be effective in prevention and for years and years have found to be effective in prevention. And I also think about too, like other genders as well. When you think about the history of PrEP, we initially know that it was something that was catered more to men that have sex with men. And then for many years, and just now in the recent years, have we started to increase more dialogue about how it's important for women, how trans identifying individuals, didn't have that much education about it, and now they've been able to get that. So it really is a trickle down effect that would only end up increasing the likelihood of someone to contract HIV because of the barriers that already exist. Would it be the opposite and we increase funding? Then that is a separate conversation.
Right. And you bring up a good point about who PrEP was originally marketed to. And we also look at who was impacted not just by the science research, but also the research on how to reach different populations. And we do know that like the trans community has not had as much research dedicated to PrEP access, same way with cisgender women. And we're really starting to see that research like ramp up, and now we're facing potential funding cuts for, well, we're seeing funding cuts for all of these research initiatives. As a grad student at who's in public health, what do you think the impact on young people and marginalized communities will be if we continue to see funding cuts specifically for research initiatives around PrEP and HIV prevention?
Yeah, so this actually hits home. This actually hits home for me because I have had opportunities that have been rescinded due to the NIH budget cuts, but also I have a friend that recently graduated that was doing research on trans women in the Upper East Side of Manhattan when she was working at her university no longer was could be employed by her university, and she kind of had to figure out whether or not she could still continue her research or if it was something that was going to be flagged and she had to start over. Those were some of her worries. Because at the same time, there is a face to the people that you're working with. And it's something that hits home because you're trying to better your community, you're trying to support those members of your community. But when the funding gets cut, then it's almost throws everyone into a frenzy of what can we do? There is a feeling of despair. There's also a feeling of resilience that gets added to every person that is working on this. And it's just detrimental because then it pushes us back. I mean, we're like, it almost feels like erasure. It feels like we're getting rid of data that supports why the funding needs to continue. So that's what I think.
Just tell us how there's a lot of misinformation about PrEP right now, which is why we are big advocates for community-led campaigns. But tell us about the impact of stigma and misinformation.
I think about the current administration's viewpoints on HIV and its origin stories that only make up misinformation for groups, like from the thought of being able to contract HIV because of poppers, or
Yeah,
like some of those ridiculous misconceptions and nothing that is supported by science, which is more of a reason why we need to support science, why we need to continue to have the funding for research, because it's a matter of um, creating a different narrative that is far, far from the truth.
thank you so much. You actually put a lot of perspective in just kind of like the whole spectrum from direct services for PrEP access and to community education and provider access to now talking about the research. So thank you very much, Christopher, for joining us today and sharing so much information about um, how these policies and funding cuts could impact not just young people but other other groups in our community as well. So thank you very much for joining us today.